Hello, my name is Joanna Rojas Enriquez, and this is my population level health education intervention project. Introduction. I use obesity can be prevented, diabetes prevention by providing screening tools to know the participants' risks, healthier eating habits by using the Eating the Rainbow campaign, and educating on BMI calculation and BMI understanding of charts. Poverty rates of Sacramento County are 53%. Obesity for Sacramento County region is higher than the state rate. Also, Oak Park zip code has a crude death rate for diabetes above the state rate and has 3 times higher mortality rates than affluent communities locally. This community is low income and has high incidence of poverty and homelessness. Upon the windshield service, I noticed that the most population use means of public transportation or walking to go to and about wherever their needs are. Yet it was obvious that the obesity was prevalent among its members. Healthy People 2020 objectives. Diabetes. Reduce the disease burden of diabetes and importance. Improve the quality of life for all persons who have or are at risk for diabetes. Obesity and BMI education. Promote health and reduce chronic disease risks through the consumption of healthful diets and achievement and maintenance of healthy body weight. Healthy eating habits. Promote quality of life, healthy development, and healthy behaviors across all stages. Needs assessment. During my windshield service, I noticed there was a lot of needs from the community. I noticed the community was a type of food desert where there was no local grocery stores or no local main food chains. You had to leave the community to actually have access to any type of food unless you needed something from the local corner liquor store. I also noticed that all members were walking, yet obesity was prevalent and obvious among its members. According to one of the stakeholders, Esperanza Cortez, they did try to establish a community garden within their church, but only church members actually participated. I suggested a more neutral space to establish a community garden would be more appropriate. Upon interviewing one of the local members, she states that she buys more non-perishable items because it takes a really long time to go grocery shopping. It takes her about an hour to get there and an hour to come back, not to mention all the in-between of the actual shopping. So she tries to avoid grocery shopping as much as she can, and when she does, she gets everything and anything that can last a really long time, excluding fresh fruits and vegetables. Theological framework and needs assessments. The Pre-C-Pro-C model was a useful tool to guide me through my project. I was able to establish an objective, identify barriers, evaluate the process of the project, evaluate the income, and evaluate the end objectives. By doing this, and using the windshield service, it was noticeable that the lack of access to food and obesity was prevalent in the community, leading to the primary objective of educating the community of obesity, diabetes, and healthy lifestyle changes, all in an effort of prevention. Issues: adaptability, knowledge, support from city government, and accessibility. Oak Park community members will need to inquire new healthier eating habits, lifestyle changes, and reduce obesity and risk for diabetes. Education of these habits needs to be done by community stakeholders, public health nursing, any type of volunteers that are willing to help, including nursing students and medical students, to have the community gain knowledge. Also, government attention needs to be brought to the lack of local access to food by using grants or some kind of supportive incentives to have local grocery stores established there within the community. As part of my interventions, diabetes, according to Healthy People 2020, the goal I used was to reduce the disease burden of diabetes and improve the quality of life from all persons who have or are at risk for diabetes. I gave education of the symptoms of hyperglycemia. Specifically, I talked about the 3 Ps and how it relates to high blood sugars. I also give handouts for patients to use to assess the risk of diabetes. This will make them aware of how much at risk they are, and it's an easy tool to take home and use with other family members. Obesity, BMI, and healthy eating. According to Healthy People 2020, promote health and reduce chronic disease risks through the consumption of healthful diets, achievement and maintenance of a healthy body weight. I gave education on how eating the rainbow can allow everyone to establish healthier eating habits and benefits of each color of the rainbow. By using the Eating the Rainbow campaign, everyone is able to choose their own rainbow without restriction or have been fixated on specific diets. This gave a better accessibility to participants to choose their own rainbow. Also, I made members aware that obesity is preventable by choice, not by genes, and how a lot of us assume that everything is by genes and not by choice. I also gave information on BMI calculation and BMI chart reading, and gave them a handout to be able to calculate not only their own BMI, but take home and assess their family members as well. Budget. Budget would be an initial startup of $20,000. The highest cost would be providing enough staff support to further the education. We need enough supplies to start education, pamphlets, handouts, surveys. We need to be able to provide the wages of at least 2 nurses, one which can do the education and another one which can coordinate. Also, budget can be lowered with time with the help of nursing students and medical students that can volunteer to not only screen patients, but educate patients on obesity and diabetes prevention. While this is a useful tool, it can only be used in the long run, as we need to establish relationships with the schools that are willing to participate in this project. Project evaluation outcome measure. My main objective is to educate OPAC members that obesity is preventable by lifestyle choices we make, and that obesity is the leading cause of diabetes. As part of my short-term goals, I wanted to bring awareness to the community. And by the end of the class, the correctness rate of any questions I asked would be greater than 50%. As part of my long-term goals, I established that by the end of 2020, at least one community garden will be available within the community, and members would actively participate. By the end of 2021, the prevalence of obesity in Sacramento County will decrease by 5%. I can measure these outcomes by looking at the epidemiology of Sacramento County, focusing in the Oak Park area, and also doing another window survey that allows me to assess any local community gardens that have been established. Results and conclusion. Oak Park community has the highest rates of obesity and diabetes related to the lack of local access and appropriate food and lack of an awareness of healthier lifestyle. My main objective was to bring awareness that obesity and diabetes can be prevented. Unfortunately, there was a lot of issues with this project because of the COVID-19. A lot of members choose not to participate to not be further exposed to people around them, as well as lack of initiative to come to the screening presentation desk because of the weirdness of getting infected. Also, I wasn't able to get support from the local food bank to disperse healthy food bags as examples of how to eat a rainbow. And I wish in the future, if I ever repeat this, I would like to have more active participants and volunteers help out to do screenings on patients, for example, glucose checks, weights and heights, blood pressure checks, and more personable education that will actually help bring further awareness to the community. More time will also be needed to recruit more food banks, other than locally, to see if they can participate in establishing healthy food bags to give more examples of healthier eating a rainbow slogan. These are all the references I used during my presentation and my project. I would like to thank you for your time.